piles are also known as hemorrhoids, and the symptoms are quite common. Lots and lots of patients come in to see their GPs and are referred on. And the symptoms from piles or hemorrhoids range from itching at the bottom end through to bleeding, which is normally fresh red, to prolapsing or something bulging out of the bottom end. Piles or hemorrhoids are completely benign conditions, which sometimes, or most of the time in fact, don't need anything bar changes in diet and local topical ointments. However, with some of the symptoms that you can get with piles, it's important to exclude anything else that is going on that is slightly more worrying, like polyps or even things like bowel cancers and so on, which again are rarer. Piles are very common, but the others are rarer. But it's important to make sure that, especially with things like bleeding, that we exclude anything more serious. And the way we do that is by often just doing a camera test or a special type of CT scan, just to make sure that there's nothing within the bowel higher up that's causing the symptoms like bleeding. And a simple examination in a clinic sometimes suffices to make sure there isn't anything else going on higher up. Then we can treat the hemorrhoids either just simply by doing nothing but changing diets. Occasionally banding of the hemorrhoids is required, but there are also other procedures available for hemorrhoids, which include stitching the blood vessels reaching the hemorrhoids, to the more advanced procedures if the hemorrhoids are large, where we perform what we call a hemorrhoidectomy, or actually excise the hemorrhoids from the bottom end. The procedure that we do is really based around a long discussion with the patients to see exactly what they want to achieve, what their symptoms are, with the primary aim to exclude anything that's worrying in the first instance. To talk about fissures, fissures are very common. They occur at any age, but more common in the younger age groups, where patients have constipated stool or pass a particularly large stool. And in essence, it's a split in the anal canal. So right at the bottom end, the skin in the anus splits, and it can be very painful to pass stool. Some patients describe it as passing a shard of glass, and the pain can last after the patient's gone to the toilet and had the severe pain, and the pain afterwards can be throbbing, last a number of hours, or it can be quite debilitating, and the pain can be there all the time. Fissures can be treated with ointments, and even can be treated with botulism toxin or Botox injections. And ultimately, if fissures don't heal, there are operative procedures such as the lateral sphincterostomy, where we make a little cut into the muscle of the anal canal, which are very successful, but they are a very common condition and completely benign, but can cause quite a lot of problems to the patient with pain and discomfort. As regard fistula or fistulae, fistulae can be simple fistulae, and the definition of a fistula is essentially a connection between two surfaces that shouldn't be there. And in fistula in ano, or fistulas around the bottom end, they normally result from an abscess or an infection at the bottom, which arises unluckily in some people, and the abscess drains out through the skin next to the bottom end, but it also drains out into the anus or into the anal canal, and you get left with a little channel that connects the inside of the anus to the outside of the skin. And these can be quite simple, and they can be treated by a small operation to just cut the fistula open, clean it out, let it heal, to more complex fistulas, which involve the muscle around the area of the anus, and require a lot more investigation with MRI scans, and sometimes a longer treatment period with something called a seton, which is the insertion of a rubber sling through the fistula, which comes out through the anus, and this sits there for a while, and allows the rubber sling to cut out without causing injury to the sphincters, because that is something we want to avoid to maintain continence. So they can range from very simple issues that we can deal with very immediately to something that takes a lot more time. And there are a variety of methods available to treat them. My favorite approach is the most conservative approach possible, either in the way of an operation or a seton. But again, this comes down to discussion with the patient, individual patient, the expectations, and also keeping the patient informed of the options all the way through, in order to get them to the place that they want to as far as their symptoms, and to avoid further complications. As far as hemorrhoids, fissures and fistulae go, one doesn't lead to the other. But it's important to note that actually you can have a couple of things, or more than a couple of things, occurring at the same time at the bottom end. And really, you can only make out what is what once you've been examined and the discussion's been had. So they can coexist, but one doesn't lead to another. So the treatments for piles, fissures and fistulas are different, and I think I outlined them earlier. The piles and fissures can be treated with ointments in the first instance, with banding of hemorrhoids, with hemorrhoidectomy. With the fissures, they can be treated with ointments again, and ultimately they can be treated with a little incision at the bottom end to just release the bottom end muscle, to relax it slightly, to allow better blood supply so the fissure heals, or the tear heals. And the fistulae really is operative management. There's no creams or ointments that would help on that situation. Operative treatment in the way of what we call laying the fistula open, or cutting into the fistula, or inserting a seton, this rubber band type structure, to allow healing to take place over a longer period. So yes, that's one of the things we see in patients who come with a variety of bottom end symptoms, as it were, is that sometimes they have more than one problem going on, either with hemorrhoids or a fissure. Like I said, fistulae or fistulas are less common, but they can occur in conjunction with each other. Yeah. So the important thing here is, and this is not to be alarmed, and it's understandably, we see a lot of patients who come in with symptoms at the bottom end of pain or bleeding or painless bleeding, a variety of symptoms at the bottom end. And it really is very important to exclude or make sure that there isn't anything else going on, like a polyp in the lower bowel, in the rectum, or certainly we want to exclude bowel cancers. And the way we normally do that is an examination in clinic, and also subsequently a camera test to look at the bowel from the bottom end. And it's a very reassuring thing to do to make sure that's the primary problem is either hemorrhoids or fissures or fistulae, and then we can deal with those things. But it's important to exclude things like bowel cancers and polyps.